airway. The block in the airway may be mild or severe. Now, if the block in the airway is mild, the person can make sounds and cough loudly. In this case, stand by and let the person cough. If you are worried about the person's breathing, call for help.
Is it good?
Hey, if it isn't the muffin thief.
Always.
This guy's always taking it.
I'm gonna stop reading that.
Every time. Hey, Philip, are you choking? I'm gonna help you, okay?
If the block in the airway is severe, the person cannot breathe, talk, or make sounds. They may also make the choking sign by holding their throat. If this happens, you must act right away and give abdominal thrusts to try and clear the airway. When someone's choking is severe, give thrusts slightly above the belly button. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think someone might be choking, first ask if the person is choking.
Are you choking?
If the person nods that he or she is choking and cannot talk, you must act.
Okay, I am going to help you.
We're not actually going to practice choking, but you can perform the following steps to help someone who is choking. When a person is choking, you'll need to give thrusts slightly above the belly button. Depending on your size and the size of the person choking, kneel or stand firmly behind the person and wrap your arms around his waist so your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak, or until he or she stops responding. If you cannot remove the object, the person will stop responding. If this happens, follow these steps. Call or have someone else call your emergency response number or 911. Check to see if the person needs CPR and give it if needed and you know how. Continue CPR until the person speaks, breathes, moves, or until someone with more advanced training takes over. Remember that a 911 dispatcher often can give you instructions on how to do CPR if needed. If the choking person is in the late stages of pregnancy or is very large, put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give the chest thrusts. Many allergic reactions are mild. The signs of a mild reaction are a stuffy nose, sneezing, itching around the eyes, itchy skin, or a rash. However, some reactions that seem mild can become severe within minutes. A number of things can cause a severe allergic reaction: eggs, peanuts, chocolate, and insect bites and stings, especially bee stings. The signs of a severe allergic reaction are trouble breathing, swelling of the tongue and face, or fainting or dizziness.
Hey, Ray, the coffee man. Means we're halfway done.
People who know they have severe allergic reactions may carry an epinephrine pen with them and know how to use it. This is a prescribed device that has medicine in it that can help such a person. There are a few types of epinephrine pens, but they work basically the same way. It's important that you be ready to help if needed, because someone with a severe allergic reaction can die if they don't get first aid right away.
He's a foot.
Hey, Bob, you okay?
I'm having trouble breathing.
Oh, no. Bob, you drank my coffee by mistake.
I'm trained in first aid. Can I help?
Bob drank some of my coffee. It's got hazelnut in it. He's allergic to nuts.
I have an epinephrine pin in my lunchbox.
Call 911 and get some help, right? I got it. Bob, can you give this yourself?
If the person is able, let him give the injection. If the person can't give the injection, you can help give it if you have been trained and your state and workplace allow it.
All right, I'm gonna inject this to the side of your thigh, okay? It's gotta be for 10 seconds.
The needle is designed to go through skin and through clothing. Hold the epinephrine pen in place for about 10 seconds. When you take it out, be sure to pull the pen straight out. After you take it out, make sure you don't put your fingers over the end that has been pressed against the person's thigh, because that's where the needle is. Rub the injection spot for about 10 seconds.
Breathe easy, buddy. Breathe easy. Come on.
Stay with the person until someone with more advanced training arrives and takes over. After using the injector, put it in a safe container according to your company's policy. Note the time of the injection for EMS rescuers and give them the tube for proper disposal. In a moment, you're going to practice using the epinephrine pen. But first, we'll show you a demonstration of what you need to do during the practice. Pay close attention, because you'll be demonstrating the same steps to your instructor afterwards.
Okay, the scene is safe. You, call 911 and get the first aid kit.
To use the epinephrine pen, make sure you are holding the pen correctly. Then take off the safety cap. Hold the pen in your fist without touching either end, and press the tip of the injector hard against the side of the person's thigh, about halfway between the hip and the knee. Hold the pen in place for about 10 seconds. Pull the pen straight out, making sure you don't put your fingers over the end that has been pressed against the person's thigh. Rub the injection spot for about 10 seconds.
I delivered the injection at 2:37 p.m. and I'll dispose of the needle properly.
Okay, now it's your turn to practice using an epinephrine pen. While the video is paused, you'll pair up with a partner and take turns practicing. Then your instructor will test you afterwards. A heart attack is a serious medical emergency. A person who is having a heart attack usually can respond, but may deny having a problem. If someone has signs of a heart attack, call the emergency response number or 911 right away.
Yeah, this wall right here, Hank, I think this is going to have to go. It's kind of in our way.
But what about elevation E? I mean, do you think that should stay?
I'm trained in first aid, Jim. Can I help?
Yeah, okay.
Can you tell me what's wrong?
My chest is really tight. Just let me rest for a minute, and I'll be okay.
Call the emergency number. The extension is 212. Tell them that someone is having a tightness in their chest.
All right, anything else?
Yeah, give me the first aid kit and the AED from the break room.
Wait a minute, Hank. Just give me a minute. This is probably just heartburn from that lunch that Sid bought me. You know, I don't want to worry anybody. And if we don't make this deadline, I'm gonna feel really bad. Why? My chest is really tight.
Jim, listen to me. Do you have any allergies to aspirin?
No.
Have you had any bleeding lately? Have you ever had a stroke?
No, neither.
Give me the first aid kit.
Oh.
EMS is on its way.
These are 2 chewable aspirin. This will help, Jim.
Oh, thanks.
Many people with an uncomfortable feeling in the chest don't want to believe that it could be a heart attack. If someone has signs of a possible heart attack, you must act and call for help right away, even if the person doesn't want you to. Act quickly. The first minutes of a heart attack are the most important. That's when a person is likely to get worse or even die. These first minutes are also important because many of the treatments for heart attack will be most successful if they are given soon after the signs of a heart attack begin. Signs of a heart attack may include chest discomfort in the center of the chest that lasts for more than a few minutes or that goes away and comes back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. The uncomfortable feeling may be in other areas of the upper body, such as one or both arms, the back, neck, jaw, or abdomen, shortness of breath. Other signs may include cold sweat, nausea, or lightheadedness. The uncomfortable feeling of a heart attack is usually in the chest and may involve either one or both arms, the neck, the jaw, or the back between the shoulder blades. If someone has signs of a possible heart attack, do the following. Make sure the person stays calm and rests. Call your emergency response number or 911. Ask someone to get the first aid kit and AED if available. If the person has no allergy to aspirin, no serious bleeding, and no signs of a stroke, give him either 2 low-dose or 1 regular aspirin. Be prepared to check to see if CPR is needed and give CPR if you know how. Remember that during a heart attack, giving aspirin appropriately can make a big difference in the quality of recovery. Fainting is a short period when a person briefly stops responding, usually less than a minute, and then seems fine. A person who faints usually gets dizzy, then stops responding. Fainting most often happens when someone stands without moving for a long time, especially if it is hot, suddenly stands after squatting or bending down, has a heart condition, or receives bad news.
Hi, I'm Charlie. No first aid. Can I help you?
Yes, please, thanks. I don't know what's wrong. I feel dizzy.
Why don't we lay you down until the dizziness goes away?
Yeah, okay.
Okay.
If you're asked to give first aid when the person is dizzy but still can respond, make sure the scene is safe and help the person lie flat on the floor. After a person faints and then starts to respond, you should do the following. Ask the person to lie down on the floor until the dizziness goes away. Look for injuries that may have been caused by the person's fall. If the person doesn't improve or stops responding, call your emergency response number or 911. Diabetes is a disease that affects levels of sugar in the blood. Too much or too little sugar causes problems. Some people with diabetes take medication to maintain their sugar levels, but if a diabetic experiences low blood sugar, his behavior can change. Low blood sugar can occur if a person with diabetes has not eaten or is vomiting, has not eaten enough food for his level of activity, or has injected too much insulin. If low blood sugar does occur in a diabetic, the person may become irritable or confused, hungry, thirsty or weak, sleepy or sweaty. Or the person might even have a seizure. You'll learn more about seizures a little later.
I don't get it. I don't understand. None of this seems right to me. They're all wrong.
Steve, you're not acting like yourself.
I'm trying to finish these student reports. What time is it? I didn't eat yet.
I see you're wearing a medical bracelet.
Yeah, I'm diabetic.
Julie, get Steve a regular soda, fruit juice, or a sugar packet. Don't bring back a diet soda. It doesn't have sugar in it. He needs sugar. Steve, it's gonna be okay. I want you to sit quietly. Would you feel better lying down?
No.
Can you eat something and swallow?
Yeah.
Signs of low blood sugar can come on very quickly in someone with diabetes. If you see signs of low blood sugar, you should take the following first aid actions. If the person can sit up and swallow, ask him to eat or drink something with sugar. If he can't sit up or swallow, don't force him. The food or drink might include fruit juice, milk, a regular soda, or even a packet of real sugar or honey. Since the problem is low blood sugar, be sure to give the person something with sugar in it. Have the person sit down quietly or lie down. Call or have someone call your emergency response number or 911. Strokes occur when blood stops flowing to a part of the brain. This can happen if a blood vessel in the brain is blocked or bursts. Some people can be given treatments in the first hours after a stroke that can reduce the damage and improve recovery. Therefore, it's important to recognize the signs of a stroke quickly and get medical care fast. The warning signs of a stroke are sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, or sudden severe headache with no known cause.
Hey, it's Lonnie. I'm trained in first aid. Can I help you? What's the matter?
Please, help. I feel funny. I can't move my arm.
It's okay, we'll get you help and I'll stay with you. Hey, Joel! Call 911. Tell them we have a woman who's suddenly having trouble speaking and can't move her left arm. Bring the first aid kit and the AED back with you. It's okay, Marlo. Do you want to sit or lie down?
Sit.
If you see signs of a stroke, make sure the scene is safe. Call or have someone call your emergency response number or 911 and get the first aid kit and AED. Note the time when the stroke signs first appeared. And be prepared to check to see if CPR is needed and give CPR if you know how. A seizure is abnormal electrical activity in the brain. Most seizures stop within a few minutes. A medical condition called epilepsy often causes seizures, but not all seizures are due to epilepsy. Seizures can also be caused by head injury, low blood sugar, heat-related injury, poisoning, or sudden cardiac arrest. During a seizure, a person may lose muscle control, fall to the ground, or stop responding. And the person usually has jerking movement of the arms, legs, and sometimes other parts of the body. A person may bite her tongue during a seizure. You can give first aid for that injury after the seizure is over, since most seizures stop within a few minutes. After a seizure, it is not unusual for the person to be slow to respond, confused, or fall asleep. The most important first aid action for a person having a seizure is to protect them from injury by moving furniture or other objects out of the way and by placing a small pad or towel under the person's head if possible. Then, call your emergency response number or 911. After a seizure, quickly check to see if the person needs CPR. If she does, and you know CPR, provide it. Stay with the person until she starts responding. If the person is having trouble breathing because of vomiting or fluids in her mouth, and you don't suspect a head, neck, or spine injury, roll the person to her side. There are also some myths about what you should do to help someone who's having a seizure. Some of these can actually harm a person instead of helping them. The actions we just listed describe the best way to help someone with a seizure.
What happened?
She was hit by a forklift.
My name is Jessica. I'm trained in first aid. May I help you?
Yes.
Okay, you and you stand on either side and watch for safety hazards.
This woman has been struck by a moving vehicle and could have multiple injuries, including shock. Shock occurs when cells in the body don't get enough blood. This can happen if the person loses a lot of blood that you may or may not be able to see, has a severe heart attack, or has a severe allergic reaction. A person in shock may feel weak, faint, or dizzy, feel nauseous or thirsty, have pale or grayish skin, be restless, agitated, or confused, or be cold and clammy to the touch.
How are you feeling now?
My stomach's starting to hurt really bad. That's where the forklift hit me. And I'm cold and weak and kind of dizzy. Please help me.
You could be bleeding inside your body. We've already called for help, but what I can do is I can try to help keep you warm. I'm gonna put a blanket over you, okay?
First aid actions for shock are: make sure the scene is safe. Call your company's emergency response number, or 911, and get the first aid kit and AED. Help the person lie on her back. Cover the person with a blanket to keep her warm. Be prepared to check to see if CPR is needed, and give CPR if you know how. This concludes our discussion of medical emergencies. By now, you should know how to recognize and respond to several common medical emergencies, such as breathing problems, including choking and allergic reactions. You've learned how to use an epinephrine pen, how serious a heart attack can be, and how to respond to emergencies involving fainting, low blood sugar, stroke, seizure, and shock. The video will now pause so that your instructor can go over some medical emergency review questions with you. Much of the first aid you will give will be for injury emergencies. Many common workplace injuries involve bleeding. We've divided bleeding into two types. Bleeding you can see because it is bleeding on the outside of the body, and bleeding you can't see because it is inside the body. Bleeding that you can see can be frightening, but the fact is that you can stop most bleeding you can see with pressure alone. The most important thing is to stay calm. Bleeding often looks a lot worse than it is.
Ow! Oh, man, my knife slipped. I just cut my hand.
It's okay. It's okay. Listen, I know first aid. I'm going to help you out, all right?
Yeah, sure.
Can you go to the break room, bring me the first aid kit, and some safety glasses, and keep these people away from here if you could?
You can step back, please. Let's give them some room.
I really appreciate this, man. Whew.
Put this down over the bleeding and press down while I put on my gloves.
Okay. Oh, you know, I have worked here for 5 years. This is the very first time this has happened.
It's okay. I'm going to try and stop the bleeding, but I'm going to have to press down hard.
Okay. Oh.
It's bleeding through. I'm going to have to put some more on.
Well, can you take that bloody one off?
No. It might pull out clots and make the bleeding worse.
Okay.
I'm going to press down harder on top of these extra gauze. I should be able to stop the bleeding with just a little more pressure and some more time.
Okay.
Looks like it stopped bleeding now. Let's get a bandage on.
Thanks a lot.
Take the following first aid actions to stop bleeding you can see. Be sure the scene is safe for you and the injured person. Send someone to get the first aid kit and AED. If possible, have the person apply direct pressure. Wear personal protective equipment. Apply